Väldigt varmt välkomna till det här seminariet i Governance Innovation Sveriges inspirationsseminarieserie om hur vi styr mot ett hållbart samhälle. Och vi vill inspirera med hur vi bättre styr och leder offentlig sektor i en tid av komplexa utmaningar. Och hur kan vi göra det med internationella och nationella inspirerande exempel. Jag heter Pia Mc Aleenan, jobbar på stiftelsen Svensk industridesign som chef för offentlig sektor och myndighetssamverkan. Och jag kommer tillsammans med min GOVIS-kollega Lovisa Vildö från RISE att guida er igenom den här timmen som vi har tillsammans här nu över lunch. Vi hoppas att ni har en god lunch att äta på sidan av, att ni stänger av mikrofonen, och vi vill bara informera att vi spelar in det här seminariet också. Och vi kan väl visa agendan, Lovisa, bara så att vi ser lite grann vad som väntar er. Vi kommer att berätta lite mer om GOVIS. Vi kommer att göra det här på lite svengelska så att vi inleder på svenska, och sen när vi presenterar våra inspiratörer Toby Love och John Motimers så går vi över till engelska. Och vi kommer också ha en panel med Jakob Hellman från Vinnova, Kristina Althoff från Statskontoret och Martin Sparre från Ekonomistyrningsverket som ger sina reflektioner efter föreläsningen. Och vi pratar lite grann om reflektioner från den svenska kontexten och berättar lite mer om våra events framåt. Och med det sagt så vill jag lämna över till dig, Lovisa, för att berätta lite grann mer om vad är egentligen Governance Innovation Sverige som vi lanserade tillsammans i våras.
Ja, tack så jättemycket, Pia. Låt oss prata om det. Vi svänger oss väldigt mycket med ordet governance inom den här kontexten. Så innan vi hoppar in i det här seminariet så tänkte vi att det kan vara värdefullt att bara snabbt berätta om vad är det vi syftar på när vi pratar om governance egentligen. Och det är svårt att hitta en kort och koncis definition av governance, men det här är vårt försök. Vi ser att det är processen av att styra, leda och ha uppsikt över riktningen på till exempel då ett land, men det kan också vara en organisation. Så det kan vara på många olika systemnivåer. Och det omfattar väldigt mycket helt enkelt. Det är i princip alla styrande och ledande processer som finns. Och vi brukar ofta prata om att det handlar mycket om samarbeten och beslutsfattande processer. Och det ska vanligtvis vara hos aktörer som ser och identifierar en gemensam utmaning. Och GOVIS då, hur relaterar vi till det där? Jo, vi ser oss som en samlande kraft och en katalysator för förändring. Genom då främst kunskapsutbyte som vi gör här idag. Vi är också måna om att samskapa mycket kopplat till just governance då. Och sist men inte minst att starta en debatt och en medvetenhet om vikten av innovation i Sveriges governance. Och det kan vi koppla då till det syftet som vi har identifierat. Och jag tror att det är många här med mig idag som delar den här bilden att vi just nu är mitt i massa samhällsförändringar. Och det har blivit väldigt tydligt att de nuvarande sätten vi har att styra och leda, de faktiskt inte räcker till. Så det vi vill göra är att öka samhällsförmåga att hantera de här utmaningarna genom att då hitta bättre sätt att styra och leda och att promota dem. Och GOVIS startades i förra året, så det var ett gäng aktörer som grundade det med också ett gäng ambassadörer, och sedan dess så har vi bara vuxit, vilket är väldigt roligt, och vi kommer återkomma senare idag kring hur vi växer på vilket sätt. Men jag tänkte inte att vi skulle ta så mycket tid att prata om oss här idag, utan det finns ju faktiskt en annan anledning till att vi alla har kopplat upp oss denna lunch. Det handlar ju om Human Learning Systems.
Jättebra, och vi ska med det snart switcha till engelska. Men vi vill också uppmuntra er, även om ni har stängt av era mikrofoner så hoppas vi att ni ska använda chatten. Så skriv kommentarer och tankar som föds i er under tiden som ni lyssnar, så ska vi se hur mycket tid vi har att fånga upp dem idag eller vid senare tillfällen med GOVIS. Så att använd chatten är en uppmaning från oss. But with no further ado, I'll switch to English and welcome our distinguished guests and inspirers from England. It's Dr. Toby Love from Center for Public Impact and Mr. John Motimers from Impro Consulting, but also working for Center for Public Impact and our GOVIS partner, Effektiv Styrning, here in Sweden. So we're truly honored that you can join us this lunch and give us an overview and casework from the approach human learning systems. And I'll give the screen to you, Toby, and you will hand it over to John when the time is right. So please, what is the human learning system?
Thank you very much, Pia, and thank you for inviting us to speak with you today. So my name's Toby Love. I am a visiting professor of public management at the Center for Public Impact, and I'm going to talk with you today about what the public management approach that can help to create outcomes in the real world. So this is what I will cover with you today. I will explore how an outcome is made. I will explore learning as the management strategy to help achieve outcomes, and then talk a little bit about how to create purposeful change with doing public management differently, and finish up with this idea of what can be governed in order to create outcomes, this idea of governing learning. And essentially my message as a whole for you is, if you want public service that achieves outcomes, then you really need a different public management approach, a different public management paradigm. So I think this is quite a good shared starting point, that the purpose of public service is to help people to create good outcomes in their lives. I think that this is now an uncontroversial statement. I think that this is one that many people would agree with. So if we agree that the purpose of public service is to help people create good outcomes in their lives, then a very important question follows from that. Okay, how is an outcome created? Because it is then the purpose of public service and the purpose of public management is to enable the processes by which we know outcomes are made. So how is an outcome created? This is one of our best representations of how an outcome is created. So this is a piece of research undertaken by the UK Government Office for Science in 2007. And this is a systems map of the outcome of obesity. So it is what happens when you shut public health specialists in a room together and say, you are not allowed out until you map all the causes of the outcome of obesity and all the relationships between all of those causes. So they saw that there were 108 different factors that created the outcome of obesity. And this is the relationships between all of those things. You can't see the 108 individual factors on this diagram, but you can see them represented grouped into themes like food production and supply, macroeconomic drivers, education, media, technology, the nature of work, the built environment, and down at the bottom of the system, early life experiences and healthcare and treatment options. And one of the things that this diagram represents beautifully is the idea that an outcome is the product of a whole system, right? So all of these hundreds of different factors working together is the process which creates an outcome. So this is the reality of how an outcome is made. And this has a really, really, really great significance for how we think about outcomes in public service. So outcomes are not delivered by organisations. You can tell that I think that this idea is important because I've written it in really big, red, shouty capital letters. Outcomes are not delivered by organisations, right? The outcomes we desire are emergent properties of complex systems. Again, this is the reality of how an outcome is made. And this has really significant implications for how we do public management. So You cannot contract on an organisation or a programme to deliver an outcome, because that is simply not how an outcome is made. And next thing, you cannot use outcome-based performance management to ensure that outcomes are created. Because if you try and performance manage for outcomes, what you are doing is holding people accountable for things they cannot control. So look, let's go back to this slide. See here, this is the whole outcome of obesity. This is the whole system that creates that outcome. Down here in the bottom right-hand corner, 4 factors out of 108 are healthcare and treatment options. These are the things that governments would tend to commission in order to address the outcome of obesity. But if you try and hold those people accountable, use outcome-based performance management, payment by results, or anything like that, what you are doing is holding these organizations here accountable for the behavior of the system as a whole. You are holding them accountable for things they cannot control. And what happens if you hold people accountable for things they don't control? They learn to manage the manipulation of data. So they learn to manage what they can control, which is the production of data, which is why all the evidence around it, all the public management evidence about what happens when people try and use outcome-based performance management is that it creates gaming. So it creates a situation where it turns everyone's job into the production of good-looking data. So if we can't purchase or directly manage for outcomes, what should we do? What we found with the research that we've done with public service organisations is that creating outcomes starts by embracing the complex reality of how outcomes are made. So what we need to do in public management terms is stop pretending that if the outcomes are made in this simple linear fashion, that if we do A, then B, outcome B will happen. Because literally that is just pretending. It is a fantasy world that has no relationship to how the world actually works. If we want to create outcomes, we need to do what this nice little person is doing, to open the door to the complex reality of the world. This is our job as people who do public management. So this is what we've been trying to explore with with human learning systems, which is an alternative approach for doing public management, and why we call this an alternative approach public service for the real world. Because it's based on stopping pretending and stopping doing that management fantasy of if we do A, then B will happen. So let's zoom in. If we care about outcomes, how is a desirable outcome created in each person's life? So what we've done here is taken this idea of a complex system that produces an outcome and tried to represent the unique complex system that is each person's life. So let's say that we care about the outcome of well-being in someone's life. What are the unique actors, the people and organisations that make up a person's life as a system that produces the outcome of well-being? And what are the factors in that person's life that produces the outcome of well-being or its absence? So in this way, we can map a person's life as a system that produces the outcome of well-being or not in their unique circumstance. So we understand that we can see that the actors involved in this system, the center of this system is the person themselves. So we represent them as the sun. Then the other people and organizations that help produce the outcome of well-being are their family and friends, the organizations responsible for green spaces, cultural provision, their neighbourhood associations and community centres, the health service, the welfare and benefit agencies, the emergency services, the local UC line. These are the actors in the system that produces well-being in someone's life or not. And these are the factors in that system: that person's income and wealth status, their employment status, their participation in democratic processes, blah, blah, blah. I won't run through. But you see here, we can represent the pattern of results, the interaction between all of these actors and the factors crashing into them. The pattern of this pattern of results is what an outcome is in someone's life. So how can we respond to this idea that each person's life is a unique, complex system that produces a desirable outcome or not? Well, what we found is that if public service wants to respond to the unique nature of each person's life as a complex system, then the approach that works is learning as a management strategy. So the way that we can represent this idea of learning as a management strategy is through this idea of a learning cycle. And this is how each person's job is framed under a human learning systems approach. Let me explain by getting us to imagine that I'm a public service worker whose job it is to work with you as a person who is currently experiencing the outcome of chronic pain in your life. So you have chronic pain, and chronic pain is pain that doesn't have a corresponding physical injury. So there's nothing for a doctor to fix. It is pain that is long-lasting, to do with the patterns of your life as a unique complex system. So the first thing we do is I would seek to help us both understand your life as a complex system that is currently producing the outcome of chronic pain. So I would try and make this system visible to both of us by saying, I would ask you questions like, do you experience the pain more in the morning or the evenings? Do you experience the pain when you're at work or you're at home? Do you experience it when you make this kind of action or this kind of action? Do you experience it when you eat these kind of foods or those kind of foods? Do you experience it when you're around these people? So together we understand your life as a system that produces the outcome of chronic pain. And then what we do is we co-design experiments in your life that seek to change the pattern of results in your life as a complex system to see whether we can get it to produce a different outcome. So we might design experiments that say, what happens if you try this physiotherapy technique? What happens if you try joining this walking group? What happens if we try fitting your house with this enablement equipment? What happens if we try eating this diet rather than that diet? So lots of experiments to run to see, let's try this and see what happens. And then we run those experiments. And then from those experiments, what works and what doesn't, we embed that as both behavior change in your life and structural change in your life around it. And in doing so, we change your life as a complex system. And therefore, the process starts again. So this work becomes public service work becomes a continuous learning cycle between those doing the work and those receiving support. And it is in this way that public service can produce a bespoke response to the unique complex system that is each person's life. And this is how an outcome is made, right? Because outcomes are unique to each and every person, because each and every person's life is a unique complex system. What counts as well-being for me is different for well-being for you. The way in which well-being is made in my life is different to the way it is made in your life. If public service is going to create an outcome like well-being, it needs to be able to do this bespoke, unique response. So that's how we represent learning as a management strategy at the level of a public-facing worker. So the people who are actually doing the work of public service. What we found is that this learning as management strategy works then at all the different system scales at which public service operates. So public service can be seen as a system at this person scale that we've looked at before, at the level of an organisation. A place is also a system that a public service operates at, and the whole country is a system that public service operates at. And at each of these scales, what we have seen is that the same learning cycle operates. So everyone's job, whether they're a manager at an organisation scale, a place scale, or a country scale, is doing their work at framing it as this type of learning cycle. And what we see is that these, what the managers do is they create connected learning cycles across the different scales, where the purpose of the learning cycle at the higher scale is to learn from and enable the learning cycles at the smaller scale. So if you're an organisation employing lots of these public service workers who have this learning relationship with people they serve, what's the learning cycle that's happening at the organisation scale? Well, the organisation is asking a bunch of learning from questions, right? So what the organisation is asking, what patterns do we see from across all of the work done as learning cycles at the practitioner scale? And therefore, what policies do we need to change as an organisation from looking at those patterns? And it's also, the organisation is asking a bunch of enabling questions, right? What are the maximum caseloads for workers that enable them to operate their work as learning cycles? What information systems do we need as an organisation to share information across all of those learning cycles? What are the shared reflective practice spaces that we need to create so that practitioners can reflect together? What are the staff capabilities that we need to recruit and train for to enable our staff to work in this way? And it is these things that are the questions that are the content of the learning cycle at the organisational scale. So it is this that is happening at the organisational scale. This is the learning cycle that the managers are doing here. And then the same set of connected learning cycles happens between organisation scale and place scale, where the place is seeking to learn from the patterns across all the organisations that achieve the outcome in that space. And it's seeking to ask questions like, how do we fund all of those organisations to work and learn together? And then similarly, you see the same connected learning cycles between the place scale and the country scale, where the country scale is asking, how do we enable all the places? How do we see the patterns from across all the places? And how do we enable the places to learn together? And you get the picture. And so what a human learning systems approach looks like to enacting learning as management strategy across different system scales. So creating this connected learning stack of learning cycles from the person scale right up through to the country and region scale. And at each of these scales, the question is, how do we learn from and enable the scale below? Because this work is built up from the ground, because that is the reality of where outcomes are created. So if we care about outcomes, we need to build this stuff up from the work of creating outcomes. So what we're talking about here is a paradigm shift in public management. So not just a change in management practice, but a change in the purpose of management and governance from deliverers of services. So what is being managed, you're not trying to manage the delivery of outcomes, because that's impossible. What you're trying to do is steward, create these effective learning systems. That becomes the primary purpose of managers. And this relates into the question of what should we try to govern in public service? And so previously, public management has tried to govern programme delivery. And the essential question, the governance question that's being asked is, have you delivered what you promised? Again, so if we care about outcomes, this isn't the right question to ask, because you cannot deliver an outcome, right? As we've seen, the delivery mindset does not work for outcomes. So what is to be governed instead if we really care about outcomes? What can be governed is the learning cycle, because these are the processes that help create outcomes. So if we want to govern in respect of the question, how do we create outcomes? What we do is we govern these learning cycles. So what are the questions that help inform those that governance process? You can ask questions about what's the integrity of this learning cycle as a learning and adaptation process. Are people learning authentically? Are they rigorously undertaking and documenting their learning processes? You can ask, are lessons being learned? So the things that are being learned, are they being translated into change practice? Right? Is practice being translated into new infrastructure? It's all of these questions are essentially asking, how is our learning achieving our purpose? And how do we know that? So how do we provide an account of this learning, and to whom needs an account of the learning? And in some respects, most fundamentally, who is included and excluded from the learning cycle? And are those boundaries around inclusion and exclusion correct? I'm not suggesting that these are all of the governance questions, but these are a bunch of the questions that governance can be concerned with if it wants to govern learning cycles in order to enable public service to help produce outcomes. So, I thought I would say a little bit about what we know about how change happens if you want to change from the current way of doing public management to the human learning systems approach. Well, what we've seen is that change happens by people doing action research into doing public management differently. So they create experiments and explorations into doing human learning systems. So the experiment and learning process is both the method of change and the unit of change. So if you want to set up your own experiment into human learning systems practice, the question you can ask yourself is, who needs to be involved in the experiment? Where are the workers on the ground working this way? Who are the managers that are ready to try working in a different way? Who can frame their work as learning cycles? What actions will you need to will you experiment with to get this process going? What data will you gather? And who will make sense of that data? These are some questions that maybe help you design your human learning systems experiment. And we've been working, so as the movement for change around human learning systems grows, we've been asked by the Scottish government that they have commissioned us to write a how-to guide for creating human learning systems experiments in public service. And this guide should be available from the middle of April. And it's a free guide to like doing in detail some of the questions that I just posed you, how to enact learning as a management strategy. So like I say, this free guide will be available for anyone to download from hopefully the middle of April. And if you want any help with that, you can speak to myself or to John, who is about to follow me, or any member of the Human Learning Systems Collaborative. And then the link to that Human Learning Systems Collaborative is in the slides that will be circulated afterwards, I think. So in summary for all of this, I think that taking outcomes seriously requires doing public management differently. So outcomes requires learning as the management strategy, because this starts with the reality of how outcomes are actually made. And what it entails is adopting learning as a management strategy, which means that as a leader, your primary task is to create learning environments. If you're a public manager, that's your primary job. And this strategy can be applied at all system scales, from frontline practice up through to what ministers are doing. And experiments and explorations is how change happens. So this is how the work is done. And but doing this as change work is hard work. It is hard graft, because you are swimming against some very powerful tides. But the payoff that we've seen from organizations and places that do this, the payoff for all this hard work is better outcomes for less money. And the essence of these better outcomes for less money is happier people, because you get happier citizens because they're getting the bespoke support that they need first time from public service. And you get happier staff because they're able to do the jobs that they joined public service to do. So that's a bit of the kind of the theory. You can see more. There's everything that we know about human learning systems is gathered together in one place, this website, humanlearning.systems. So you've heard a bit about the theory from me. Now you're going to hear an example in practice from John.
Hello, everybody. It's great to be here, and thank you for inviting me. I'm going to put on my slides in a moment. I just want to give you a background to a little bit of a case study that this is typical of the kind of work that we do with human learning systems. So we're going to look at someone in the community who had a typical citizen who had medium level problems. And that's why we picked her as a case study. She's just an ordinary person in an ordinary municipality with quite a few different kind of issues that she faced. And what we wanted to do, we wanted to learn what it was like from her perspective. And she was seeing different parts of the public sector. She was seeing a social care doctor. There was some connection with the police, and she was engaged with social housing. She, when we initially looked at her, she was living on her own. She is looking after 6 of her children. She wasn't coping very well at all. And she has a disability. She uses crutches to walk. So what we're going to do now is look a little bit more about her situation. And what we found, what we found when we talked to her is that her health was actually deteriorating. She was depressed and she was in pain, and some of her children were actually wetting their beds. She was suffering under the impact of domestic violence, and so were her children. And she was failing to cope with the 6 children. She was a qualified hairdresser. We didn't know that, but actually she was qualified to do a job which she enjoyed. She felt alone, and she felt that she was fighting the system, because every time, and this is certainly a characteristic of the health and public sector in this country, is that they have to go to different places to get different types of services. She hasn't been up the stairs to the bedrooms of her children for 8 months. Her house had been broken into twice. One of her ex-partners was still harassing her. And one of the things that we found out from social services is that they were concerned that potentially her children might be taken into care. And if you look at Anna and you look at the fact that she's got 6 children, we look back into what was going on around her, and she had a whole load of other people that were connected to her that were members of her family, or used to be members of her family. And we had to take those into account because they were part of her life. So what we did is that we went back into the records that we had, and we found out what was going on with Anna several years before. And that was when she started to live away from her family. She was struggling to cope with 3 children at this point in 2009. She was a victim of domestic abuse. And at this point, she said that she needed help from the public services. In 2012, she was still a victim of domestic abuse. She was trying to cope with 4 children, and she was pregnant. And there was an impact of domestic violence on her children. At that point, she lost her home. So she went to the public sector to organize social housing because her family was getting bigger. In 2016, her relationship with her partner at that time was under strain. She was struggling with 6 children. She was isolated socially from her friends, but more importantly, from the rest of her family. She'd been threatened with eviction, which meant that she potentially had to leave her current home. She needed a bigger home. She was being harassed by an ex-partner, and she was worried about the safety of her daughter. Her left had left her with debts, so she had no money, basically. She was in debt. She had to give up her job, so up until this time, she was working part-time. And her health was increasingly deteriorating, and that was, she was depressed, and she was in increasing pain. I need help. So this is actually the picture that we found when we look back at what was going on over all those years. And this is the kind of thing that we did. This is just an example of the detail that we went into. We went into all the records of all the different public sector services that you can see at the bottom. And we looked at different flows, different health flows. So this is an example of mental health. And when we looked through that flow and we mapped it, there were 45 steps in the mental health flow. There were 11 handoffs from one person to another. There were 10 different roles involved. There were 6 different systems involved. And the question we had is, out of these 45 steps, how many of these steps are actually value steps? And the answer was 4 of them. So the question now we have for the leadership of the organization, what's the cost of managing the flow through the system? And what if we only did the value work? And this is the kind of thing that human learning systems gets us to ask those questions. So let's have a look at what Anna actually wanted when we went to her. She said, I need help with the housework. I need access upstairs. These 2 things would have the greatest and most profound effect on all of our lives. But in the old service, this is what she received. She received anger management courses for 2 boys. She received a parenting program. She had help cleaning 1 bedroom, not the others. And she had some adaptations and equipment for her bathroom. And this took a whole range of people to implement. When we actually look through several years of this being delivered to her, these are all the different types of people. and all the different handoffs in particular. A referral, 30 referrals. A referral really means when I take the responsibility of doing a job and I pass that on to somebody else. And 16 times were assessments made in different ways about Anna and what she needed. So we then looked at the cost of what Anna actually wanted. And the cost was just over £20,000. The cost of what Anna actually got since 2016 was £106,000. So from 2016, for the next 4 years, this amount of money was spent on her, yet she got worse. Why did she get worse? Each of those elements of the public sector were doing what they should be doing, but they were completely disjointed from each other. And what we did is we tracked the cost over a period of years. And you could see there that the red line is the old service and the blue line is the service that we actually wanted to provide to her in terms of this is what she actually asked for. And there's a significant difference, as you can see there. So the team, we employed a financial analyst to really look at the detail. And also the team helped to predict what would happen into the future, 10 years into the future. And it was very likely that her children, at least most of them, would have been taken into care. And that's the projected cost of what would have happened to her in terms of the red line. And the total cost would have gone up to 781. So this is a cumulative cost. The blue line is the cost of what she actually wanted, that the team were satisfied that that was what she could have hoped with. She could have coped with that. She could have coped with her children. So you can see the difference in cost from 781,000 to compared to £60,000. And we weren't confident that she was actually going to get, that actually this was going to improve. Children going into care is the worst situation. Are we making an impact? So the team spent some months in a small locality to actually look at the impact of what happens, not just to Anna, but to all the people that they were dealing with. What I'm going to do here is look at an increase in severity of the people, the citizens in that locality. There were 57 people that needed a small amount of help. There were 27 people at the beginning of this that needed a moderate amount of help. So Anna would have fitted into the moderate category. And there were 4 people that would have fitted into a chronic need. They need serious help, ongoing help. Now, with the team and what they did over a period of months is that the top number 4 didn't change because the team weren't addressing that level of need. They were addressing the next level of need. So from 27, it went down to 13 over time. So the people then who needed moderate help went down to I need a little help. So the 57 increased to 71. So the learning from this is that help citizens when they ask for it. And that is very often early, and the need may not be so great, but do it then. Firstly, it costs a lot less into the future. And secondly, you're actually helping people in the community to put their lives back on track. Because particularly with Anna and so many of these, they wanted to get back their life. They wanted to go back. They wanted help to get their life back so that they didn't need that support anymore. So just to summarize in terms of the learning that we got from this, both from the team and from the leaders that were connected to this, is we asked the question, why do we behave this way? And the answer is, we all have, the leaders and managers have separate budgets and targets, and they manage just that particular part of their job and their department. And they protect their department, and they don't work well with other departments. They actually, in some cases, work against them. And we very often pass on responsibility. We enjoy passing on responsibility to another department because that's that job gone away from us. And what we do is we treat the obvious problems that citizens have. We don't look at the whole picture like we did with Anna. And very often the mid-level managers know that this doesn't reduce cost, but the leaders think it does. And demand goes up. Demand goes up and increases over time. And why is it like this in England? What's the consequence of doing this kind of work in England? It's very difficult to move these kind of small prototypes further because the current design of the health system and the public sector and the governance pushes those managers and leaders back to where they were. It's very difficult to push against that. And what we've learned is that it needs a fundamentally different approach and leadership at both of those three levels, the national, regional, and local level, in the same way that Toby expressed. Anyway, that's my small case study over. I hope that you have understood that, and please, if you have any questions, just put it into the chat and be able to help answer those questions. Thank you.
Thank you so much, Toby and John. This is super interesting. Taken from an English context, we're now going to move into the Swedish context and what we feel that we can relate to, and if there are inspirational things that we should explore more here. I'm just thinking that there's a bottom-up approach, there's a system approach being that you are both talking about, and which makes this human learning system very, very special. But it's also one of we have some great questions already in the chat, and please continue to write, and we will try and get back to them. But Rich has talked about the bottom-up approach, and also being that it might be difficult with hierarchy. So moving from the local to the national levels, and how is this being done? And Toby has provided a case study from Finland. So please look into that and we'll see. There's another question, Toby and John, about how to cope within public sector organizations that have very few resources. So is this approach, would it cost more? We have just seen that it costs less for our services, but the amount of time that it needs for the civil servants and the capacity to build these new skills, does that cost a lot? And how have you seen that, Toby?
I suppose, like any change program, this kind of change requires investment, because you need to enable people to frame their work as learning and give them the resources required to genuinely learn. And so that it does require some upfront investment, but the savings that can be made from doing this, what we've seen is that more than offsets the cost of that initial investment. And the other thing I would say about this is that because experiments are the method and unit of change for this, the experiments for change can start really, really small. So, well, like some of the human learning systems experiments we've seen start with a single worker saying, do you know what, I'm going to do my job differently. I'm going to take the time to build relationships, to build learning relationships with the people that I serve. I mean, it costs them a bit more in kind of time and whatever, but they get massively increased job satisfaction as a result of it. So I would say, like any change program, it does require investment, but it doesn't have to be a huge thing or the start, because we are dealing here with complexity, and so the ripple effects of just one person changing what they do can be really significant in a system.
Super. We have gathered a few experts from the state administration. So we have Kristina Althoff from the State Office. We have Martin Sparr from the Swedish Financial Management Office, and we have Jakob Hellman from the Swedish Innovation Agency. And I'm just going to start with you, Kristina, to think about what the main obstacle, from your perspective, what is the main obstacle or the governance challenge that you see the clearest, or one of the challenges that you can see, and
Yes.
What is it that you're inspired of by what you've heard?
I'm just going to check. You hear me now?
Yes.
Okay. First of all, it's so exciting to listen to you, John and Toby. And I think that we have recently published a report that addresses this on another level, but we have looked into cross-sectoral issues or challenges, if you want, and I think that is what we would call a complex system, not around the individual, but it's the system of complex. So we have seen that one big obstacle is that the government policy on these cross-sectoral challenges is vague, because they don't have and they cannot have like the complete competence around this area or this system. So they have a vague policy, and then they create a strategy for working with this area or this challenge, and it shows priority and importance to this, like to address this system, but it lacks direction. Because as you, Toby and John, you said, it's hard to see what the outcome can be, and we're used to being able to measure outcomes, but it's a system, so it needs collaboration and it needs learning and competence. So when this strategy is going to be converted into an action plan, I don't know if my words are right, but I think you understand me. Okay, great. You're nodding along. Okay. So then there's a void between the political level and then the central government administration or agencies. You have like a governance void, because there's no one to translate between the political level and what they want, because no one really understands, and then the people actually working with the system. So I think that what you presented today could be one among other tools to make it visible what we need to address while making the action plan. And so we evaluate the public management and state funded actions and activities in the state at the agency where I work. And I think that we've seen over and over again that collaboration is really important. Also collaboration along the chain of governance, that if you're able to ask down the system, what do we need now to make this happen? You get better commissions or assignments to the administration and the agencies, and you can create better outcome over the whole system, I think. So to answer your question, Pia, I think this void and lack of tools to bridge the void I mean, that's as we saw, that was the biggest challenge. And then we have a lot of course, we said that there are other challenges and other solutions, but this is one of the biggest main findings, I think. But really interesting to listen to you, Toby and John. You made it so visual, and to put pictures to this problem. This was exciting.
Super interesting. Thank you, Christina. And also very good to see that your report is sort of, this void needs new capacities, new skills, and we need to figure things out how to do this. Toby and John, just store this as a treasure and we'll return. But Martin, I would want to ask you the same question. What are, as you see it, one main obstacle or challenge when it comes to the governance in public sector Sweden? And if there was anything in particular that you thought was interesting in what you've just heard.
Very interesting. Thank you, Toby and John, very much. I embrace system thinking very much, and I've been working with it in the government for at least 20 years or so. And well, it's not, I mean, you can't give an answer on your question, actually. I think the big problem is Well, one of the biggest problems, I think, is that there is a big tension between politics and those people doing the work, so to say, because politicians tend to seek for simple answers and simple solutions. And that's kind of point of the election system, that you tell the voters how you can solve different problems. And then you need to mention one or mostly three things, something like that. So that's one of the really basic problems, I think. And unfortunately, I also think that many economists think the same way. They're very reductionists, and that's another big problem, since economists have a lot of power in the whole system. So, and I'm saying that having almost all my colleagues being economists, so I'm of course risking losing my head. But it is a basic kind of philosophical or scientific question at the bottom line, where we all learn to be rather reductionistic in school, and the way of thinking in systems and embracing complexity and trying to handle that through learning is not really something we learn in school still. So, and we have been talking about system thinking since at least the 60s, where this really started off, and we still have a system producing outcomes where we don't use systems thinking enough. So that's a big problem to solve. I'm really looking for how to do this, and I just hope that we will, with time, be able to transform in the way that Toby and John are looking into. I've done something quite similar to what John explained in a municipality in southern Stockholm, and we looked at domestic violence, and also followed not only the woman and her kids, but also the man within the judiciary system. And we collected all agencies and all public servants connected to this system and met through, well, almost a year and discussed the system. That was really very fruitful, but also, as you mentioned, Pia, very time consuming. Yeah. And one of the big problems is then, of course, that people change all the time. So if you start to learn about the system with one group, you will end up discussing solutions with another group at the end. So that's also a more practical problem. But it was a very good way of reforming the work with domestic violence in that municipality. And we actually changed some of the basic structure of how these agencies cooperate, which was very fruitful. So I still very much believe in this way of working, and I really embrace all initiatives to empower us to work with in this way.
Then Martin, in order for us as a society to move, I mean, we've been thinking and talking about this for so long. What is it that what is stopping us as you see it? Is it this? Is it the politics and the simple solutions, the logic that we have that needs?
No, but we're stuck in the system. The problem is to change the system because you can't. It's power, of course, at some point too. Yeah. Those in power are not very eager to change the system, but we also, I think, we're not brave enough. We have been speaking about innovation within the public sector for at least 15 years almost, and we still don't really question the basic flaws in the system. We still just try to improve minor processes or minor parts of the systems, and the innovations are very, very few. And I think that's because we don't have the courage to stand up to new ideas or to really question, because there's sometimes a very, very narrow corridor where we're allowed to be, so to speak, and to be correct or to be accepted in our communities. So that's another problem.
And I think turning over to Jakob, talking about innovation, but I just as a comment to what you just said, Martin, I think the learning approach could maybe give bravery into the civil servants. That there's a learning mental model here within this framework. I think is interesting. But Jakob, what do you think that the obstacles as you see them from Vinnova, and also what you found inspiring?
Thank you for inviting me, and thanks a lot, Toby and John, for interesting talks and presenting a really great framework. And I totally agree, it's a different paradigm indeed. So and as Martin, I embrace system thinking and been working with that as well. So it's really in line with that. But I guess my main reflection is that we kind of need more examples, more concrete examples to shed light on this framework. You presented some. I can think of some in Sweden, but we don't need like 5 or 10. We need hundreds of them. Hasn't have to be that big, but experiments. And yeah. So, and I think for Vinnova's role is to be a partner in that kind of direction. But I was thinking about one example about was quite close to what Toby spoke about concerning comorbidity, samsjuklighet. Yeah. Because we had example in Sweden. I think some participating in this work is listening, so maybe you can add something. But we had a special commission of inquiry in Sweden focusing on comorbidity. That's really in line with what you've been talking about. It's really a systems view is necessary, and we haven't designed our system for the desired outcome. It's a single disease system. But the inquiry, I guess, came to conclusion something similar that you presented, and they start to work with something called hälls, the health lab organization with system designers, and did some kind of design experiments when they trying to walk through this different kind of scales that you talked about as well, going from the individual needs up to the policymakers and the national level and back again to do more experiments and providing insights. So that's just one example I thought about that was really in line with what you've been talking about. So we need more of those.
Super. And just to hand over very quickly to you, Toby, because if there are cases here in Sweden that sort of you have 100 or you have 60 case studies in the human learning system, but is there any chance of Sweden providing examples into your approach or using cases from you?
Yeah, I mean, so it would be for examples where people have taken this kind of approach and people would like to write that work up using the kind of human learning systems framework as a reflection tool, basically. Then there is a template for people to write their case studies on the case study page of the HLS website that I put into the chat there. So you can download the template and then just we can then upload that onto the case study page, and if you like, we might be able to help refine the case study or blah, 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 blah. So there's opportunities for people to share the work that you've done along these lines and become part of that kind of broader community of change.
Super. I need to.
Sorry, I was just going to say, if people are, don't worry about, if you want to start an experiment of doing things differently, don't worry about scale. Right? Just start, because if you start, change will happen because of the ripple effects. And I mean, the toolkit will advise you on the good actors that are useful to assemble into a single experiment, how to spread and all that kind of stuff. But the most important thing is to start.
Super, very good. And I think from one thing that we have been able to see is that there's a lot of shared experiences. We share the same kind of frustrations. We can hear from Jakob, from Martin, and from Christina that this is also something that we see in a Swedish context. And we need to fill that void with different new methods, new mindsets, and maybe what you're saying, Toby, just to get started, to start small and to try and take this onwards. And speaking on taking it onwards, the clock has now gone to 1 o'clock and we will finish. But Lovisa, this discussion, all the good things in the chat, we will continue to have this discussion going and boiling. So what's the next step?
Exactly. I just want to say thank you, Pia, for guiding us through the seminar. It was really nicely done. But yeah, we have a lot of other things coming up as well. I won't take that much time going into detail. We'll email this presentation out for you so you can read it through quietly. But what we do is we welcome new members to Governance Innovation Sweden at what we call a digital introduction meeting. This will be Swedish here. Our next meeting is the 23rd of May. And if you want to get an invite to that, you can contact me. You'll see my contact information at the bottom there. But we also do have a next breakfast seminar at Vinnova the 2nd of June, and also a panel discussion at Kvalitetsmässan in Gothenburg the 3rd of May. So there are a lot of different things happening here, but the questions that you posted is what we'll bring forward with us when we talk about these things further.
John and Toby have also said very kindly that they can join us for one of these meetings and continue the discussion if anybody's interested. So super. Lovisa, from you and me to all of you, so much for taking your time this lunch, and let's keep this pot boiling. We need the change, and we need to start the small ripple effects. And I think we're a few people here who really want to do that. And go into the website, governance.innovation.se.
Yes.
Thank you very much, everybody.
Thank you so much.
Have a nice day. Enjoy the sun.